Hello everyone, it's Dr. Nirav Pandya. A lot of people have questions about the injury that Aaron Rodgers suffered to his Achilles last night in his first game with the New York Jets. Here's a quick breakdown of Achilles tendon ruptures, what the treatment protocols are, what the general return to play timelines are, and what it means for an NFL quarterback. Now, the first important thing to understand, the Achilles tendon is very important for plantar flexion of the lower extremity. That is basically pushing off in terms of running, jumping, or cutting. So whenever an athlete suffers a complete rupture, it can be very difficult, if not impossible, to play sports with any degree of injury to the Achilles tendon, not to mention a complete rupture. Now, for some athletes who are not necessarily playing at a professional level, you can treat this without surgery. There are various new studies and protocols that basically demonstrate that you can have a pretty good outcome if you're not playing at that professional level. But most professional athletes will undergo surgery for this rupture. What the surgery basically entails, and there are various different techniques that are out there, but at its heart, you're basically sewing together the ends of the tendon. Now, what helps to determine how athletes will do after the surgery is the quality of the tendon. Obviously, a younger patient will have better quality tissue. An older patient may have a little bit more degeneration in there. The key is that during that early phases after surgery, you're trying to basically get the tendon to heal. Then you want to get back mobility, you want to get back strength, and then you want to get back to explosive activities such as running, jumping, and cutting. Now, in general, every surgeon will have a little bit different protocol, but usually for the first 6 to 8 weeks, you're protecting the repair. Usually that means using a boot and potentially using crutches. After that first 6 to 8 weeks, you're working more on mobility, regaining strength, and then starting things like running, jumping, and agility. Now, protocols can vary from surgeon to surgeon, but in general, athletes can usually return to doing most things uninhibitedly at 6 months. Now, when athletes actually return to play can vary based on their position, their sport, and their age. So for some athletes, that can be 9, 10, or even 11 or 12 months when they return to the field. But as early as 6 months, they can start doing most activities. Now, if you look at NFL players in general, the return to play rate somewhere is between 60 to 70%. That can vary based on position. For a wide receiver, a cornerback, or a running back who uses their Achilles a lot more, particularly for running and for speed, the return to play rate can be a little bit lower, whereas for a lineman, it can be a little bit higher. Now, the important thing to note, there's not many NFL quarterbacks who have torn their Achilles. There have only been a handful over the past several years. So therefore, the data in terms of return to play for an NFL quarterback isn't necessarily there. Now, if you look for a player like Aaron Rodgers, the fact that he is a drop back passer who doesn't necessarily depend on his mobility, the chance of getting back and playing at a high level is much higher. But there are lots of different factors that can play into this. Number one, the quality of the tendon. Number two, how his rehab goes. Number three, his confidence level. Number four, what the muscle strength actually is, particularly if you had a history of prior calf injuries. The important thing to note that although surgical techniques have advanced, this is still a career-changing injury. How an athlete rehabs, the quality of his tissue, the position he plays, determine when he comes back exactly, and what it means in terms of performance down the road. The last question a lot of people have is, how did artificial turf potentially play a role in this? It's hard to know exactly if artificial turf played a role in this, particularly since he had more of a traumatic injury. But we do know, based on some of the studies that are out there, that artificial turf does have an increased risk of lower extremity injuries, particularly in NFL players. Whether this directly played a role in Aaron Rodgers, we're not 100% sure, but we do know that turf does carry with it an increased injury risk.